everybody. Today we're discussing the structure of the mandible. It is the jawbone, and it looks like this. And we will go through the features and different structures of it, and foraminas and fossas and processes and notches and stuff like that, and how it participates with the temporomandibular joint of the skull. Okay, so just keep this image in mind, and you'll see different labelings and stuff like that as I go along explaining its structure. Okay, and if you want to see it in relation when it comes to the skull, that's how it's situated, and it gives rise for the lower alveolar fossas or dental alveoli that allow for the exposure of the lower jaw teeth, and that's how the processes are inserted within the skull structure. Okay, so let's just dive into it. The mandible. The mandible, it is a bone of the lower jaw, the only movable bone of the skull, so it is easy to move around. It's formed by the body and the two rami. Okay, so the body is this one, and ramus 1, ramus 2. Okay, so the parts of it, we have the posterior process called the condylar, anterior one is called the coronoid, and between them we have the mandibular notch. Okay, and if you look at the condylar process, we have the head and the neck within it. This is the ramus, and anterior part of the ramus contains the coronoid process. The condylar process is the process that is or takes part in the formation of the temporomandibular joint. Okay, now we're going to go dive into the other features. Now this part right here is called the angle of the mandible. This part right here, extending from the anterior border of the ramus of the mandible down into the structure of the body, is called the oblique line. We have the alveolar margin. The alveolar margin that contains or the alveolar process of the mandible contains the dental alveoli that give rise to the teeth. Okay, then we have the symphysis manti. It's just a small symphysis at the anterior part of the mandible. The mental protuberance, a small protuberance, and it's palpable in the anterior part of the body of the mandible. The digastric fossas are found right here, and then you have the mental foramina. And another foramina that is present is called the mandibular foramina, is found here. I'll show you in the next labeling. So here it is a horse-shaped, having two borders and two surfaces. Upper border, alveolar margin, carries a socket of 16 teeth. That's the alveolar margin. Okay, the upper border. The lower border. The lower border contains posteriorly with the it continues posteriorly with the ramus of the border of the ramus, as you can see right here, and it shows a digastric fossa on either side of the midline of the mandible anteriorly. The outer surface shows the following features. It has symphysis menti, mental protuberance, and the mental foramen, as we discussed. Okay, the inside now, we're looking at the inside structure of the mandible, the inner surface. We have also mentioned the oblique line externally, but in inner surface contains the superior and inferior genial tubercles, and they're found here. That's just the dissection of the mandible from this region. If we cut it like that and we look at the interior surface, we have the mylohyoid line, which is found right here. The mylohyoid line somewhere there. You have the sublingual fossa and the submandibular fossa. Okay, so two fossas and one line between them. The ramus of the mandible, it projects upwards as obvious from here on either side of the mandible. It has four borders, two surfaces and two processes. So the four borders are the posterior border, mandibular notch, anterior border, and the lower border. It has two processes, the condylar and the coronoid. Okay, and we have mentioned all of those. The inner surface, as we have said, has the mandibular foramen, and at the region where the mandibular foramen is found, we have something called the lingula. Okay. The lungula is a small tongue-like process overhanging the mandibular foramen anteriorly. So the mandibular foramen, always remember, in relation to it, is a small tongue process that extends called the lingula. Okay, the mylohyoid groove is present, the coronoid process, as we said, and the condylar process has the head and the neck. These are some attachments for the mandible, and we don't need this for now because you will discuss the muscles later on this semester. And remember, this part of the mandible is the angle, okay? Some ligaments that are attached to the mandible is in relation with the very well-known temporomandibular joint that allows for the stabilization of this joint. So these ligaments hold this mandible in place for the stabilization of the joint. The ligaments that are found, first we have the temporomandibular ligament between the temporal bone and the mandible. So it's called the temporomandibular ligament. It's between the articular eminence of the temporal bone with the condylar process of the mandible. So temporomandibular ligament, as it says here, from the articular eminence to the lateral surface of the neck of the mandible. So it's lateral, so it's on the outside, okay? It's not on the middle part, but it's on the outside. So from the articular, so you can actually touch it, okay? I can actually touch it. Stylomandibular ligament, the stylomandibular ligament from the styloid process, stylo to the angle of the mandible. Stylomandibular ligament extends from the styloid process to the posterior border of the angle of the mandible. So from the styloid process to the posterior surface of the angle of the mandible. And this is for the this is one of the main ligaments that allows for the stabilization of this joint. Okay, the sphenomandibular ligament. The sphenomandibular ligament extends from the spine of the sphenoid bone right here, and to the lingula of the mandible. So we know that the lingula of the mandible is found on the medial end, not the lateral, but the inside, internal medial side of the mandible, just close to the mandibular mandibular foramen, and this is called the sphenomandibular ligament. Okay, and finally, the pterygomandibular ligament extends from the pterygoid humulus to the posterior end of the mylohyoid line of the mandible. Okay, so these are basically the general ligaments that you have to know in relation to the stabilization of the temporomandibular joint. And just to let you know that the temporomandibular joint is between the articular surface or the articular fossa of the temporal bone with the condylar process of the mandible, and between those two there's an articular disc, and this is a joint that is covered by an articular capsule, and for the stabilization, all of those ligaments are present to help allow for the stabilization of this joint, and it's mainly the main contributor to the allowing of the movements of the jaw. I am just one thing I have to also mention is that the temporomandibular joint, it is a type of, one second, let me just answer a friend here. Sorry. Yes, it is a type, sorry, just give me a second. Okay, it is a type of a synovial, condylar, and hinge type joint because it allows for different movements. And as I said, the joint involves an articular disc, and it's made up of fibrocartilage. And yeah, that's just one of the joints that are part of the joints that you have to mention for the point of the joints of the skull in your oral. And talking about the joints of the skull of the oral, I have never shown you guys the sorry, just give me a second. I've never shown you guys the skull at birth because they're part of the joints of the skull. So we have the temporomandibular joint that we just discussed. We have the sutures and we have the fontanelles. And the fontanelles are just present at the skull at birth in infants. And you have to know this part right here. And all the fontanelles, the anterior fontanelle, posterior fontanelle, the anterolateral sphenoidal fontanelle, and the posterolateral mastoidal fontanelle. And the most important part about these fontanelles is you have to know when they ossify, when do they become bone, at what stage of growth. So for the anterior fontanelle, it tells you it's between the two parietal bones and the two halves of the frontal bone. Remember that at birth, the frontal bone is 2 and the parietal bone is 2, and there's an anterior fontanelle between them. Frontal bones they fuse and become one, such just like the anterior fontanelle, it ossifies and becomes bone. Okay, it closes at the age of 1.5 years. So that's around 18 months. Okay. Posterior fontanelle, a triangular membrane between the two parietal bones and the occipital, right here. And it closes at the age of 8 months. Okay. The anterolateral sphenoidal fontanelle, on each side of the pterion, remember the pterion, and it closes at the age of 3 months. Posterolateral, the mastoidus fontanelle, one on each side, and the region of the asterion, which is also closes at 3 months. Okay, just remember these are very important to mention for him, and he likes those months, and you'll be good for the joints of the skull in general. All right, this was the mandible and the joints of the skull, the fontanelles mainly. Let me know if you have any questions, and stay tuned for the upcoming video.